A lazy eye does not necessarily mean a strabismic eye. My name is Medina. I am an orthoptist. On this channel, I would like to inform patients and their parents, provided with detailed information, explanations, and tips about the eye conditions. Eye conditions such as a lazy eye, strabismus, refractive errors in children, double vision, and headaches caused by computer use, for example. In this episode, we discuss lazy eye, which we also treat with patches. I would like to tell you all about what exactly a lazy eye means, how often it occurs, and what the cause of a lazy eye is. What is the treatment method for a lazy eye? What can we do about it? I will also give you all some tips. First of all, what is a lazy eye and how does it develop? In medical terms, we call it amblyopia, also known as lazy eye. What does that mean exactly? Lazy eye means nothing more than the visual acuity of one or both eyes is not fully optimally developed, despite having the correct eyeglass correction. It arises in childhood, and if not treated in time, a person can retain that lazy eye for their entire life. A lazy eye can have various causes, and one of the main causes is a strabismic eye, where, for example, one eye fixes well on a single point, looking perfectly straight, while the other eye pulls either inward or outward, upward or downward. The eye that is not being used still receives information, but our brain suppresses it if it occurs during childhood. And because the information is suppressed and not used by the brain, that eye falls behind in development. What causes a lazy eye to develop? And another common cause is a refractive error. It often occurs when one eye has a lower strength than the other eye. The brain uses the eye with the lower strength, and the eye with that high prescription is therefore not used by the brain. The information comes in, but it is suppressed. A lazy eye can develop due to the eye with higher refractive errors. Of course, if that is not corrected in time. So if a child has a refractive error and you only find out much later, then the child has a lazy eye. Lastly, it causes a blockage of visual input. The eye has a bit of a blockage in its vision. So the light doesn't come in, for example, because one eye is open, but the other eye is drooping a little or drooping completely. Not enough or no light at all enters. Then the brain naturally won't use that eye, causing the development of visual acuity to deteriorate, which can lead to a lazy eye. Another cause that might prevent light from entering is a congenital cataract, or a cataract that develops in childhood. And what do we mean by that? Cataract means that the eye lens is simply not clear. And because it is not clear, no light enters. And as a result, the eye's visual development can deteriorate, leading to a lazy eye. Now that we know exactly what a lazy eye is and how it occurs, let's talk about how we find out that has a lazy eye. As we now know that a lazy eye occurs at a young age and you want to treat it at a young age, preferably be done with the treatment before the age of 7 or 8. So you naturally want to find out in time if someone has a lazy eye, so you can start treatment on time and ensure that your treatment is completely successful. Fortunately, in the Netherlands, all children are screened at a very young age by the consultation bureau doctors. And during the screening, suppose the youth doctor discovers that one of the eyes sees blurry, not having completely optimal vision. Either it cannot be measured in children, or they are unsure. Or there are many cases of lazy eyes and refractive errors on both sides of the family. Then it can also be a reason that the youth doctor, such as the consultation bureau doctor, or perhaps even the general practitioner, refers the children to an orthoptist and an ophthalmologist. What we mainly do is check if the eyes are perfectly aligned, if the eyes work well together, and if the eyes move well in all directions. With that, we can also see if all the eye muscles are working properly, and then we will check per eye if the eye can see well. I brought this along so you can get an idea of kinds of tests we do with children to determine if the vision of the eye is good. For children from the age of 4, we usually perform this test called E-hooks. And we ask this to a child with a card in order to identify if the legs are up, down, left, or right. And if the children are still very young and cannot do this very well, so their hand coordination is not quite good yet, then we can also perform this test. These are indeed all 4 illustrations. And let's actually see on a card from a distance which illustration it is. And then the child can show that, match it, and then we can find out if one eye sees well and if the other eye sees well. And then the children get drops in their eyes. This makes the pupils large. The black part of our eyes, they become completely large. And with that, we can see if someone has refractive errors. And then the ophthalmologist will check if the eyes are otherwise completely healthy. Is the eye lens good, clear, healthy? The inside, the blood vessels, and the retina are all healthy. I will show you what the ophthalmologist will do when the pupil is nicely dilated. So the pupil of the eye is large. And then the light can shine inside, and the doctor can check if the eye lens is good, the blood vessels, and everything looks good from the inside. So this is how we can test if the eye is functioning well, is healthy, has a prescription, refractive errors or not. Suppose the eye itself is completely healthy, everything is perfectly fine, but the child does not see very well with one eye, and we find out that the child has a refractive error. Suppose someone has +2 in the good eye and +5 in the other eye. What we are going to do, step 1, is always to give glasses first. The glasses are the foundation. When we have given the glasses, we usually allow the child 2 to 3 months to get used to such a prescription. And with that, we can also see if the visual acuity has improved a bit over a few months. Usually it does get a little bit better. And very often the visual acuity of the eye with the higher prescription still lags behind. And then we start with the eye patches, the famous eye patches, which you have often, surely seen. A child walking with a patch on the eye. Well, in our example, this eye had +2. The other eye had +5. Glasses were given. The glasses helped somewhat. But this eye with the high prescription is still lagging a bit in visual acuity. So what we are going to do is prescribe patches, which you can get at the pharmacy. You cover the good eye, put on the glasses, and then we will train this eye with the high prescription, with the lazy eye. We will essentially force the brain to use this eye so that the visual acuity improves and the child sees better and better. This is indeed, of course, a great example for girls in many ways. For example, with this girl, you can see that one eye actually needs the patch, and this girl is wearing glasses over the patch. But as you can see here, so this is beautifying Frozen Elsa, a very popular character from the movie Frozen. But there are also various other types of patches available from different manufacturers. And there are also some really nice creations and designs for children of all ages. And for boys and girls, there are also different kinds of patches. It's nice if it can be made a little bit fun for the children. Applying that patch is of course not always easy or fun. But it is made a bit more fun because the sticker has a really nice color and a nice drawing. So that can make a child a bit happier about putting on the patch. We prescribe a patch and then every 3 months, 4 months, the child comes back for a visit and we test whether the visual acuity of that lazy eye is steadily improving. Very often, when it is perfectly patched, you see the child's visual acuity improve just a step after 3 or 4 months, and then another step forward. So if the child has very low visual acuity with the lazy eye, you have a very long way to go, of course. So every 3-4 months, a step forward, another 3-4 months forward, another step forward. So suppose your good eye has perfect visual acuity, normal visual acuity of 1.0, and the lazy eye has 0.3. Then in our terms, you have 7 steps to go, so that the visual acuity reaches a full 1.0, the best normal visual acuity. And only then, when both eyes can see equally well, do we choose to gradually reduce the number of hours you needed to patch. So it will take some time. Unfortunately, you won't be done within 2-3 months, but your own orthoptist can certainly give you an estimate. What I want to suggest about patching is that the lazy eye might be so severe, meaning that the eye has very low visual acuity. So you patch the good eye of the child, so the good eye has nice normal vision, but suddenly that nice normal vision is gone because of the patch. So this eye of mine can see perfectly well, so we put a patch on it, but the other eye sees very blurry, even when you wear your glasses. So as a tip, I always want to tell parents to start by applying it in a familiar environment, preferably at home, so that the child doesn't panic and is somewhat already familiar with the surroundings, so that an accident doesn't happen, where the child might bump into something or fall very hard. And of course, you also miss the refined or depth perception a bit because this eye is blocked. And of course, you also miss the visual acuity, not just that, but also the visual field. So if something comes from this side, suddenly you can't see it and then something can go wrong. The child might fall or there could be a collision. So preferably just at home, especially in the early stages, either in the morning or in the evening. It's best to let your own orthoptist judge that and give you tips, because sometimes it's useful to patch in the morning, but sometimes it's actually not allowed in the morning. In that case, you should patch later in the day, so you should ask your own orthoptist about that. And when you apply the patch, you ideally want the child to be visually fully engaged. So we say that not always, and certainly not for people with nearsightedness, for children with nearsightedness, but for lazy eyes and farsightedness, you can sometimes say, preferably do that while watching TV, for example, or using a tablet when the child is visually very active, drawing, coloring, those kinds of things. So when you are actively engaged in looking, I notice in practice that fortunately, it almost always eventually succeeds in achieving good visual acuity. But unfortunately, that is not always possible. Sometimes children have often patched for 5 years and the lazy eye visual acuity still lags behind. And then, of course, at some point, it's ultimately the choice to keep what has been removed. Then you can taper off, then you are done. But that doesn't mean, and I hear this very often in practice, that if the visual acuity of the lazy eye has improved, the eyeglass prescription has also improved. Unfortunately, the eyeglass prescription has more to do with the eyeball itself and the eye lens and the cornea. So, we are really talking about the eyeglass prescription in terms of the cornea, the eyeball, its size and lens refraction, all of that. But the lazy eye is definitely naturally more about the signals to the brain not being developed. So by using patching and wearing glasses, you are effectively developing those signals to your brain, thereby improving the vision of the eye. But unfortunately, that doesn't mean that the eyeglass prescription will improve because the patching doesn't affect that. So in our example, the child actually had +2 and +5. Therefore, using patches or wearing glasses won't make it better, unfortunately. Fortunately, it won't make it worse either. But the most important thing is that the visual acuity improves. So the vision, the development of the eye with looking, is going to get better. And then at some point, if you can see equally well with both eyes and the visual acuity is 1.0, then you no longer have a lazy eye. That is, of course, super good. But if you do nothing and it is not treated in time, the lazy eye remains. So for example, in our case, the child will continue to have a visual acuity of 0.3 and it will not get better. Suppose something happens to the good eye of the child, then the lazy eye does not see very well, and we certainly do not want that. Hence the use of patches. As I have explained, treating a lazy eye is not always simple, nor is it always easy to do, but I definitely continue to motivate my little patients. I indeed continue to explain things to the children. Most importantly, parents and the child themselves should ideally understand what the condition is, why the patches need to be applied, and what it all means. So motivate, motivate, motivate. And what we also like, I usually give a nice poster to the child. Then, when the patch can be removed, stick it on a poster. This way, you can see how many days you have worn the patch. Then you can keep track of all that nicely. It naturally motivates you to do your best every day. And when you come back for a checkup and we see that there has been some improvement in vision, that's of course a big celebration. So I keep motivating the children and their parents well. That is very important. And most importantly, the child should also understand why the fluffy patch needs to be worn. Of course, with a very young child, it is challenging, but try to explain as much as possible in a child-friendly way. This way, we can cultivate more understanding together in the field of lazy eye or eye conditions. And hopefully, this will definitely make the treatment much easier, smoother, and more enjoyable. If you have any questions, I would love to hear them. You can always ask them below in the comments. I will do my best to answer all questions. Subscribe to this channel and let me know which topics you would like to see covered. Thank you. Bye.